Thank you very much, fellow Africans, and welcome to this episode of the Change for African campaign. And so, fellow Africans, it's on Thursday, and on Thursday, it's all about our fourth pillar of the Change for African campaign, where we dive on matter to do the living standards of our people in Africa. So, fellow Africans, this morning, allow me to present to you our 79th episode, whereby we are relating the topic or our pillar number 4 of living standards to what we call to one of the United Nations Sustainable Development Goals key target. Today we are on key target number 3.4 under the goal number 3 of the United Nations Sustainable Development Goal, which is all about good health and well-being. And key target number 3.4, it's all about reducing that by 2030 they want to have a reduction in mortality of premature death that are related to non-communicable diseases. Non-communicable diseases, we are speaking of things to do with diabetes, we are speaking to do with cancer and other chronic diseases that are non-communicable. So that is all we are speaking about. And so before we dive now into the African context, because we are discussing the United Nations Sustainable Development Goal, because this is Change for African campaign, a movement aimed at civilizing the African youth. But then before we now come into the African context of discussing or trying to exemplify this goal, I would like us to understand one thing, or just a quick statistic in the global context, like what has been happening now globally. That, like, for example, in 2019, now under this key target, the NDCs, we have what we call, in 2019 we have actually 41 million deaths were reported that are related to non-communicable diseases. And not non-communicable but premature death. So premature death are termed in two terms. You have a premature death, that these are deaths that happen below the age of 70, because remember 70 is the mortality rate of it should be the moderate, of the average mortality rate globally. So once we have many deaths being reported and before people are able to get to that age of 70, then it's termed that as a premature death. So that is why we discuss in that context, because now having 41 million people dying premature death, but then 17 million of these, almost a half of these people, they die due to the non-communicable diseases. Now what the key target is focusing on, all about reducing that by 2030 we should have a reduction in the the reduction in the premature death related to non-communicable diseases. So this is something that we should be focusing on. Now, coming into the African context, what we are getting is that in Africa, over 30% of death occurring in Africa actually are premature death. And it is they are aiming that Africa being part of the global stage, there's an aim that by 2030 we should also be at least be able to secure or reduce by around 800,000 mortality. This is an issue of concern still. And so now, what do we mean to speak about premature death, more so in the context of of these non-communicable diseases? In Africa, these are worrying situations, and you find that examples of diabetes, some of these diseases actually due to how people are living, the lifestyles of how people are living. Now, directly into the African context, the way people live in Africa, now speaking about the living standards of the people of Africa, it is very worrying, and you realize that it is actually very difficult for these people to be able to escape from such calamities related to the to these diseases, the non-communicable diseases, NCDs. Because these are diseases that mostly it's due to the lifestyles of our people, and I find that life situations actually force people to live some kind of lifestyle that is not worth, it is nugatory, if I may term it that way. So it becomes a problem that in Africa, yes, our people may want to have some decent life, but you find that the situations in Africa, the living standards of these people do not allow, so they end up just coping with life the way it is. So it becomes a problem. That is why the Change for African campaign is here to first try and understand, to make people understand, bring that civilization of people that there's a problem here, and if we do not watch, this is going to finish us. So we need to be very watchful. We need to after speaking out the practical part of it, we need to see what are the new steps we are going to take. So speaking about these non-communicable diseases, we also have cancer being part of it. and other chronic diseases. These are serious issues. Now, coming to the issue of even if we speak about non-communicable diseases, we also need to understand that even though our people may be forced to live such conditions, still at the end of the day, they do not find the requisite also health infrastructure or facilities that are able to actually cater for them once they attack with such diseases. So it is still an issue of concern. When people try and speak about being able to reduce this, because they're targeting that a third of the reduce at least by a third the population of people who succumb due to these non-communicable diseases, and also who succumb premature, who go, who have experienced the premature death. They want to cut the premature death in numbers by 1/3 and all related to the NCDs, the non-communicable diseases. So these are still issues of concern, especially in the African context. The living standards of our people are very down. So we find that when people of Africa are being attacked with these diseases, the lifestyle they live in do not allow them to be able to even seek further medication. So they end up succumbing due to they lack the resources. So it is an issue of concern. Not that Africa cannot be able to stand for this, but it is because of how things have remained in Africa. Africa is being led by people who have no empathy. Africa is being led by people who are not ready for change. So it becomes a problem. So it is an issue that we need to come together, amalgamate, and see what we can do in able to rescue the African continent, especially when it comes to the issues of non-communicable diseases. This is all about the living standards of the people of Africa in the African context. We discuss Africa because we are African and Africa is our business, so we have to discuss Africa. Thank you very much, fellow Africans. Have a great Labor Day. For those who are actually celebrating it, wherever you are, and let's meet on Friday tomorrow as we dive on what has to do with climate change that we face as an African continent. Thank you, and have a great it's morning, it's afternoon, it's evening, or whatever it is, and have a great afternoon. Thank you.